If you've got a kiddo with autism, then you probably know there's about 1,000,001 different services that your child could take advantage of. And a lot of them are helpful. But you may be thinking, when it comes to my child learning how to talk or communicate better, I know that ABA works on it, and I know that speech therapists work on that. So what's the difference? Well, today we'll talk a little bit about it, and I will say that I am a speech language pathologist, so I've got a little bit of a bent, but I have worked with so many ABA professionals, and we'll just chat about some common questions, concerns that I hear from parents, and I just can remember one kiddo in particular that I've worked with in the past, and he came in, had a ton of behaviors, was just kind of ping-ponging, running around the room, had a really hard time sitting and listening and participating in what we were trying to work on. So we had a chat with the parents about looking into some ABA services. And in case you're not aware, it's applied behavioral analysis, some ABA therapy. And they said, okay, great. So they looked into it. They got started with services. And over time, I could see a big improvement with their child's behavior. Let's call him Jack. With Jack's behavior, Jack was able to sit, was able to attend, was able to have better eye contact, almost creepily in a way. He tended to stare sometimes. And his speech was coming along, but what I started to notice was that since Jack had started ABA, he was sounding more and more robotic. So everything started with, I want blank, please. I want blank, please. And he had a really hard time using any new phrases, any new sentences. If we tried to work on varying it up a little bit, it was really, really difficult. So that is just one of the many examples of children that I've worked with in the past as a speech therapist that started getting ABA, and I could see the differences between it. So we'll dive into a few topics, a few hot topics today regarding the difference between ABA and speech therapy in terms of the approaches that they often take. And I'm only one speech language pathologist, so I can only talk from my experience, and I am not an ABA trained professional. So I'm only going off of what I've observed and my experiences, but maybe you can relate to some of them. Maybe you can, if you can, if anything of this is like, yeah, that's me, feel free to just drop a comment. Let us know what your experiences are when it comes to working with either one or both professionals and helping your child communicate more clearly. So the first thing I wanted to talk about was what's the difference between the two and how they approach communication. And what you can kind of think about it is one is a generalist and one is a specialist. So ABA providers often work on a lot of different things. They work on toileting, they work on dressing, they work on reading, they work on fine motor skills, they work on communication. So they can often be generalists. And that tends to be a traditional approach to ABA programs. Whereas a speech language pathologist is more of a specialist. Yes, we can work on lots of different things in terms of enunciation and pronouncing sounds correctly, understanding, following directions, some social skills, putting words in together to form sentences. So we work on lots of different skills as well, but they are all surrounded and related to communication, whether it's understanding language or using language or making their communication more clear or getting along with others. So when you think about, okay, I've only got so much time in the day. I've got more than one kid. I can only bring my autistic child around to so many services. What am I choosing? These are some questions that you can start to ask yourself. Okay, do I want a generalist? Do I want a specialist? Which one do I go to? And maybe there's different ones that you go to in different seasons of your life. So one of the things that I've noticed when I've worked with kids, again, who've had some behavior concerns, is that ABA can be very helpful in working on behaviors, especially those that are self-injurious. So a child who's maybe pulling hair to himself, banging his head on the wall, hitting himself, or can be aggressive towards other people. So scratching, pulling, kicking, pushing, hitting, throwing things, all of those of course, are behaviors that we want to look into. How can we support this child to learn different behaviors to express themselves, whatever it is at the core of what they're trying to get across? What can we do to, they call them replacement behaviors, to teach them replacement behaviors so they're doing something else instead of the hitting, kicking, biting, head banging, whatever the case is. ABA, I found personally, has been great in teaching children and families and the people that they work with how to replace some of those skills. So there's a time and a place for each of them. And then there are times when I've seen kiddos, again, who are quote unquote higher functioning, and we all know that there's different levels, and that's a whole topic for another day. But when they work with kids who are maybe a little more verbal, more socially aware of what's going on, when those kids go through ABA, what I find with their communication is sometimes they get stuck. So again, thinking about the education and the background of ABA versus speech therapy, we've got one that is a generalist. They know a lot of things about a lot of different areas. Behavior is always going to be the underlying way that they approach things, though. So whereas a speech therapist might look at teaching language through play and through natural interactions and through adjusting the environment, ABA provider might looks through the lens of behavior. So how can I alter what happens before a behavior happens or what happens after? So how can I change the antecedent, what happens before, or the consequence, what happens after, or changing the environment? That's a very general way to describe it, but that's kind of what they look at for everything. So when they're looking at speech and language, they take that into consideration as well. So what opportunity can I set up for the child to be able to say a word or sentence, and then how can I praise them for that? How can you teach them a very specific sentence? I want blank. They get what they want. They say the sentence, get what they want, get the praise, and that's how they teach the language. So a very behavioral approach. Whereas speech therapists can often do a different variety of techniques to go into that and teaching them those skills. So again, generalist versus specialist, a time and a place for each, sometimes both, especially if they're working together, but also just different educational backgrounds as well. So another thing that I've noticed when looking at, okay, what is the real difference between ABA and speech therapy and how they approach language and teaching children how to communicate more, is the views on echolalia. And I'm really thinking about doing a much longer discussion and training on echolalia. But when it comes to echolalia, there are a lot of different opinions. And echolalia is also known as scripting or parroting, and it's basically when children imitate language that they hear from other people or from a TV show or movie or a song in the exact same intonation and way. And there's different opinions about what to do with it. So some people, what I've noticed is on the ABA side of things, a lot of times they will look at extinguishing that behavior because it can be very distracting and it's not as socially appropriate, put that in quotations, that some people would like in terms of using language and communicating with others. So for instance, a stranger comes up to your child in the grocery store and says, "Oh, hi, what's your name?" Child says, "Oh, hi, what's your name?" So again, that's not the expected response, of course, from having a question. So a lot of times what I've found in ABA programs is they'll look at extinguishing it. So they'll look at eliminating it, getting rid of it. And they'll may teach things like, or they may use phrases like, no more TV talk or quiet mouth. And that can have a time and its place, again, for kind of having a child with autism fit into this box of what is socially accepted in today's day and age. What I found through some research and just working with a lot of kids on the spectrum, as well as reading up on theory of natural language acquisition is that echolalia can often be one of the most powerful tools to help our kiddos on the spectrum to learn language, especially when it comes to learning new language and to really communicating with others. And again, that's a whole bigger topic for another time, so keep an eye out for that. Definitely something that I think is valuable to discuss, but echolalia doesn't have to be something that's squashed or looked down upon, as it often is when it comes to ABA, in the sense that a lot of times what natural language acquisition, that approach takes, is looking at how children on the spectrum acquire and learn language differently from neurotypical kids. And echolalia can often be the most powerful tool to help them learn new phrases, learn new sentences. They're kind of gathering what we call gestalt, so they may learn in whole chunks, whereas neurotypical kids may learn one word, then start to combine two words. Kids on the spectrum often learn whole chunks of language. They'll gather it all up in a database, per se, in their minds, and then they'll start to manipulate it to form their own sentences. But when we're constantly telling them to stop doing that in terms of using echolalia, one, it can stop them from even wanting to communicate with others, because that may be the only way they know how right now. They may not have their own language to use, so they may be copying someone else's language. And if you think about it, we all do that to an extent. But echolalia can be a way for them to participate and communicate even if they don't have their own words. So if we're telling them to stop using that, that inhibits and stops the flow of communication in general. As well as if they're constantly told to stop, then they're not hearing and acquiring and picking up new phrases to learn. So again, I won't get too far down that rabbit hole, but the first thing that we talked about that was the difference between ABA and speech therapy is one provider is a generalist and one provider is a specialist. Again, pros and cons to both, but just kind of putting it out there. The other thing that we want to look at is their view on echolalia. So ABA providers tend to squash or want to eliminate the use of echolalia because it's not as socially acceptable as we'd like, I guess. And whereas a lot of, and not all, again, just my opinion for speech therapists is we have an opportunity to use echolalia as an advantage and a tool to help children on the spectrum learn new language. And the last thing I wanted to chat about today was just the way that I've seen kiddos who come out of ABA have difficulty with generalizing some of the skills, especially when it comes to language. All I can talk about is language because that's all I know in terms of my training. But a lot of times what we'll find is ABA therapy has the data to back it up, has the research to back it up when working with children with autism. But one of the key things to remember is that the way that they have such solid evidence is that the way that they teach is often very regimented and strict. And so when they're teaching children how to communicate and expand their language, they're often basing their data off of certain phrases. So again, you'll see the I want robot is what I call it. Kids going around saying, I want cookie, I want balloon, I want bubbles, I want mashed potatoes, please. We don't talk like that. Neurotypical people don't talk like that. And nor is it enough of a variety to really see, okay, is that what they're really trying to say? Or are they trying to say something else, such as, can I have some more? Or I'd like some macaroni, please, or whatever the case is. Having that rich variety of language is often not seen when kids are only getting ABA because, again, they're basing their data, which is what drives their practice, which is awesome. Data is fantastic, to get the results that they need to master the goals to get through their program. They're looking at a very specific phrase and they're drilling and teaching that phrase a lot in lots of different settings. So when it comes to trying to teach kids new ways of asking for things or new ways of saying things, I don't see that a whole lot with kids that go through a lot of ABA. The other thing is sometimes they have a hard time generalizing among different people. So maybe they do great with one of their teachers, one of their behavioral interventionists, one of their ABA providers, but then they have another person come in, say their school teacher or their speech therapist or even mom or dad. come in and try to do the same exact activity, and the child often has a hard time doing that, generalizing their skills, carrying over their skills from one person to the next, or from one setting or environment to the next. So they may be able to do it during ABA in the clinic, but when they get home, it's a whole different story. When they go to school, it's a whole different story. Again, because they get into this very regimented way of doing things, which again, for our kiddos on the spectrum, a lot of times they need that structure and that expectations, and that is great to an extent. But we have to remember to move them beyond that, to move them, okay, how are they using this in their everyday life? How is this becoming more natural? How can we make sure they're doing it at home and at school and in the community and everywhere that they're going? So again, just a very general view of the difference between ABA and speech therapy when it comes to learning and developing language. The first thing is to consider, if you're thinking about, okay, which one can I do? I can only pick one, or I can only do one right now. Which one do I decide? One is a generalist and the other is a specialist. Think about, if your child is using echolalia, what is the approach? What is the ABA provider's approach? What is the speech therapist's approach to echolalia? Are they trying to squash it down, or are they trying to use it as a tool to help learn new language? And then think about, how is your child generalizing the skills, carrying over the skills that they're learning to different people, to different activities, to different places. And if you are doing both, or you're going to decide on one, if you're doing both, I would say my biggest recommendation is to make sure that those providers are talking to each other, collaborating. Okay, I know that you've got this knowledge and evidence and expertise in behavior. How can we use that in our speech therapy sessions? Because all Jerry's doing is running around the room, and I can't figure out how to have Sally sit down and really focus, or Tanisha's just pulling her hair and banging her head on the table. I just can't figure it out to do. Draw on the resources of the ABA provider to help with those, as well as have the ABA provider talk with a speech therapist. Hey, we're heading into the community and doing more social things. Can you help with that? Or I can't get him to think of different phrases or language to use. Can you help me with that? And collaborating together is an awesome idea. And then I'm thinking, now that we've got all that going, I know that was a lot, but what I'm going to do is download this video and put it into this brand new software that we've got called Searchy, and it'll allow you to be able to type in and search any phrase that you heard me say. So if I say, Jessica, you're talking so fast, you can type it up and search it just like you do with Google, but in a video. It's awesome. So I will definitely share that with you guys once I get that up and running within the next day or so. But also, I just wanted to invite you, because I'm thinking about starting a community for moms of young children with autism, just to have a place to focus on how can we help and support each other with helping your child communicate, because we know that communication is one of the biggest things that kids on the spectrum need to work on. So how can I share my tools and resources that I've used with other families, as well as how can you find somebody else who maybe is in a similar situation as you? So lean on other moms who are going through a similar situation, or have maybe gone through that in the past. So really creating this community of supportive, not kind of, gossipy or bashing or anything like that, but just a place where we support each other, where we learn new tools, we empower each other and you in order to be able to navigate through the school system and the therapy and the insurance, as well as give you tools so that you can help your child communicate better, especially if you've been on long wait lists or aren't too thrilled with the therapist your child's had. All of this is a place that we can start to create. So I'm thinking about doing something like that. If it sounds interesting to you, feel free to just send me a private message and say, hey, this is something I would love and really need, or I know somebody who could really benefit from that. And then I'll also drop a link in the comments below in case you want more information and you want to know, hey, this is something I'm interested in. Tell me more about this community you're creating. So nice to see you. I'll be doing definitely more of these talks in the future, and I look forward to seeing you soon.